already going on, just makes it a little bit more difficult, doesn't it? If you set up and you normally I'd arrive in, I'd get everything going before people arrived. So this is a new experience for me. So I'm hoping that it's going to screen share now. Let's see if this is going to work. Can people see my slides now?
Yay, it's working, yeah. That's fantastic.
Okay.
Thanks, Siobhan.
Okay, fabulous. So social work and kindness. What can I just confirm? What time have I got till? What time is everybody expecting? Because I think the time I've written down might be incorrect. Maybe, is anybody still there?
Yeah, sorry, I was just looking at the timetable.
Okay.
So till 4 o'clock.
Till 4 o'clock. Fabulous, thank you. That's fine. I just wanted to clarify that. Okay, so in terms of what we're going to be looking at then this afternoon, I've been reflecting a lot on kindness and social work over the last 18 months or so. I've been doing a lot of work on moral injury, and I've been doing a lot of that across the Greater Manchester Partnership. So I've seen quite a few people, I'm sure, who are here in sessions about moral injury. And the main thing that I've been drawing out of all of the work that I've done on moral injury is the importance of kindness in our practice. Once I started to look, what I've realised is that there's a real gap in terms of references to kindness in our professional knowledge base. And so I've started to talk a little bit about it, write a little bit about it, and people are now starting to contact me about my work in this area and tell me about their experiences. So in the session this afternoon, what I'm planning on is sharing a little bit with you about how far I've got in terms of thinking about the role of kindness in social work and why we haven't got it in our theory base or our knowledge base, if you like. Share a little bit with you some of the things that people are telling me, but also give you some ideas that you can take away and use in your role as practice educators. I'm hoping that I mean, we've not been able to see you on camera. It's difficult to know if you're all just kind of doing what sometimes people do with online training, carrying on doing their emails, writing reports, just with the kind of online training up in the top of the screen going on. I'd really like it if you had the opportunity to just sit back and be guided through a reflective afternoon, because I think social work is so busy, it's so emotionally challenging, and we need the time sometimes to just sit, pause, breathe and think. And so I'm hoping that you'll be able to use this afternoon in order to do that. I have used for many years, I think for 35 years now. I've been a social worker for 32 years, practice educator for about 28 years. But when I did my course, it was a 4-year course. So it's 36 years since I started my journey in social work. And for 35 of those years, I've used this as a framework in everything that I do. What, why and how. I use it in everything, and I think it's so helpful for us to think about in our work with students, in our work as social workers. When we're going out to see somebody as a social worker, what we should be looking at is what's happening for this person. Why has this situation come about? How can we work with them to bring about improved outcomes or positive change? But I think the danger is that the why question has started to fall off the social work professional agenda. Things have been so busy. I think this was happening before the pandemic, but it's been exaggerated by the pandemic. The temptation is to think, what and how? What's going on? How do I deal with it? What's happening? How am I going to respond? And we lose the why. There's such a danger for us in doing that. It leads to very bureaucratic, managerialist, proceduralized practice. It's also a loss of professional curiosity, and we know how important that is. It takes us towards a medical model of practice, because the medical model is, what's the diagnosis? How do we treat it? There is no why in the medical model. So when we bring why, it brings growth into our practice. It's where theory happens. It's where reflection happens. It's where learning takes place. Over the years, I have absolutely loved working with students, because they will ask me, why do you do it like that, Siobhan? It just makes you think, really, doesn't it? Oh, I've done it like that for 10 years. I'm not really sure. just got into doing it like that. The why question is really helpful. Students aren't asking me why as much anymore. Students are more often asking me, what form do I fill in? How do I get this done? What do I do next? And I'm worried that actually lots of aspects of what really matters in social work are getting lost at the moment. So because this is so important, we're going to use it for this afternoon's session. I use what, why and how in everything that I do. And for you as practice educators, if you think about what we bring into supervision, David Wilkins' research in listening to one of his pieces of research where they listened into lots of audio recordings about, this was from child protection supervision, but you could draw it out into any aspect of social work supervision. The research team, in looking at whether they thought the supervision was reflective but had a practice focus rather than being just case management, they considered the questions in listening to the supervision. Do we know what the social worker is going to do in the next visit or few visits? Do we understand why and how? So has each discussion helped the social worker to think more carefully about what they're going to do, how they're going to do it, and why they're going to do it? And I use that as the golden thread in the supervision that I provide. So after we've discussed each topic within supervision, I do a quick summary with students. Can they talk me through their what, why and how in this piece of work, just to make sure that they understand the what, why and how, and so that I can get it recorded. And that works really well. So you might want to take that idea. It does work well, what, why and how within supervision. But I use it to structure everything. So today I'm going to try to cover, and it's a lot to cover in less than 3 hours, but I'm going to try and cover something around what we might mean by kindness in social work practice, why it's important and why we seem to struggle with it a lot, and then how we can ensure there's more kindness in social work practice and how you can take it forward in your work as practice educators. In many ways, what I'm going to try and do is build on an idea of theorising kindness. I can't see the chat when I'm screen sharing. Literally, all I can see is the screen in front of me. I feel like I'm just chatting away to my laptop, and my laptop's probably fed up of hearing me talk about kindness. But I'm going to start off by asking you to put something into the chat. I'd like you through this afternoon to chat with one another in the chat about kindness, about what it might mean, about what it looks like, about whether we're doing it well enough in social work. So let's get the chat going with, what does kindness mean to you? What is it all about? We use the word a lot, don't we? We bandy it around a lot. But what does the word kindness actually mean? What does it mean to you? Maybe just on the surface, what does the word kindness mean? And then start to dig a bit deeper. Well, what might it mean? What might it look like in social work? So what does kindness mean to you? If you put that into the chat, then I'll continue to explore some elements of what I think kindness means, but we'll pull on the chat in a little while. As I'm going through things, as I said to you, I'm also going to try and give you some ideas around things that you can use with students, not just around the area of kindness, but just tools and techniques that you can use as practice educators. When I'm exploring words, I love going back to dictionary definitions. And if you look at the dictionary definition of kindness, it says that it's a quality of being friendly, generous, helpful, caring, and considerate towards other people. Or it's an act, something that we do, showing this quality. So that's what kindness is said to be about if we look at the dictionary definition. I can't see what you're putting in the chat, but I'm hoping that you're putting something into the chat about what the word kindness means to you, what kind of image it might conjure up for you. When I'm thinking about how I want to help people with a concept in social work, when I want to help people's learning, whether it's as a practice educator or increasingly as a trainer, I really, for myself, want to start off by understanding what exactly is it. So, for example, I've done lots of work on what's the difference between a theory, a model, a method and an approach. I like to know what, because if I know what, I can understand the how. When you know what something is, it's much easier to do the how do I do it. So that connectivity between the what and the how. Recently, in the last couple of weeks, I do a series of webinars. They're free. You can attend them. Free. If you attend live, you get a follow-up email and certificate. A lot of people I know watch them back on YouTube. But with a group of social work students, some of whom are now qualified, then I do these webinars every Wednesday night. And we're ending this season. We always end the season with an A to Z. And next week, next Wednesday night, will be our last one of the season. We'll have a couple of weeks off over Easter. And we're doing an A to Z of social work skills. When we do an A to Z, the team, each member of the team picks a letter and they talk about it, and then I fill in the other letters. And there's been a lot of debate between the team about, is that a skill or is it a value? Because some of them have been talking about things like, I don't know, trying to think now, integrity. Okay, is that a skill or is it a value? Is it a principle? So I've started to get a bit interested in that as well, and we've been debating it quite a lot recently. I really do like to pinpoint exactly what something is, because if we don't understand what it is, we don't know how to use it. And I think especially for students, if they know what it is, they're more likely to be able to know how to use it. So it might seem strange to say, keep on at what is kindness? What is kindness? It's something that is just there. Maybe we don't think enough about exactly what it is. And maybe that's going to impact on how we can use it in social work. So in my work with students and in my training, I often use the concept of head, heart and hands to get them to think through their practice. So getting them to think about, what are you thinking in your head? You know, it's a great reflective tool. It's a really good learning tool. It comes from social pedagogy, which is great for drawing on ideas around learning. The idea of head, heart and hands. So I use it in two ways. I use it to think about theory, helping students to think through their body of theory. I get them to think about the theory is what sits in your head in a way, because that's how you understand something. So a theory is all about our knowledge and understanding. So it sits in our head and our thinking. The heart represents your overall approach to practice. How do you like to go about something? What's your overall approach? What sits right at the heart of what you do? Hands is like the model that you're using, because it's your hands-on intervention. What am I actually doing in this situation? It's your hands-on intervention. And then in the other hand, you'll see there's a tool drawn. That's the method that you use, the specific tool in practice. The tools that we use are almost always drawn out of models. So that's why it sits in the other hand. You've got the model in one hand and the tool to put that model into practice in the other hand. So I've used this for quite a long time to help students to learn about theory as it applies to their practice. So instead of talking to a student and saying to them in supervision, what theory are you using there? Because you know you're going to get a terrified rabbit looking back at you in the headlights. I'm more likely to say, can you tell me about your body of theory here? And help them to feel a bit more comfortable in their skin, really, I suppose, around the theories, the models, the methods, everything that's influencing their practice. If you want more on this, a lot of these ideas you can find more. If that's something you think, oh, that could be useful, I've not done training with Siobhan on that, there's a YouTube video that you could watch back about this, and I can send some of the links when I send the slides over. I suppose I'm wanting to show you how I use head, heart, hands in a range of different ways. It's also really useful as a reflective tool. So helping students to really think about themselves. The idea of the head, heart, hands is it's really great at positioning things within us, especially early in a student's career. Sometimes when they're reflecting, they're good at reflecting on something that's happened, but they've separated it out, almost as though they're just an observer in the situation. They're going to tell you all about what was going on in the situation, but they don't position themselves into it. And so there, I'd really start to try and get them to think about their own head, heart and hands in this situation. So what were you thinking about when that was happening? What knowledge were you drawing on? What was happening in your head? What about in your heart? So how did you feel? How did other people feel, do you think? The questions on the prompt here, you don't have to use, you could prompt in other ways. Hands, what were you doing? What skills did you use? Ingram talks about the value of using head, heart and hands to structure supervision discussion, and he adds in the idea of feet, where Ingram says feet could represent what's grounding your practice. So values, what keeps you, I suppose, perhaps what keeps you standing firm in a situation, maybe your values, your standards. Through the pandemic, this has been such a useful framework for me to use to reflect. One of the Social Work England pieces of CPD I used this. I reflected on the way in which my head said one thing, my heart said another thing, and there was like a fight between them that gave me a bit of a headache. And when I got to the hands, I talked about my hands were tied behind my back because there was something I'd not been able to do that I'd really wanted to do. I got down to the feet and I kicked myself with the feet because there was something I should have anticipated that I hadn't anticipated. I remember writing that reflection using this as a tool, and it was really helpful. So head, heart, hands can be really, really helpful for us to think something through and to think about ourselves, our use of self. And for me, kindness and the use of self are really closely connected. So I've been trying to play around and theorize, I suppose, if you like. When I'm going into what is kindness, I really want to look at where does it sit? And I suppose this is just my thought. I think kindness isn't necessarily a skill. It's not knowledge. It's not a value. It's not a principle. I think it's a virtue. I've tried to kind of look at all of the literature, all of the theory base in social work, all of what we draw on as social workers. And I think that kindness is a virtue. Definitions and exploration around what a virtue is always refer to it as a moral standard. And I'm going to come back to that moral aspect. But if I really dig in, where does it sit? Does it sit in the head? Does it sit in the heart? Is it in the hands? I think virtues like kindness should sit everywhere. Kindness should influence our thinking. It's about what sits in our heart, but it's also about what fills our heart. You know about things being heartwarming. Virtues like kindness sit in our heart, but also warm and fill our hearts. And they sit in our hands as well, because they impact on what we do and how we do it. And they even impact on the tools that we've got and use. In fact, take it further and say, add in the whole lot. You've got to find your professional feet with kindness. It's there in your gut instincts. Your gut should have kindness. It's even in your soul. It links to spirituality and social work. It sits everywhere. But my fear is, I wonder whether the profession has become a bit of a skeleton in terms of kindness. I think there might be a range of reasons for that, and we can explore that as this afternoon goes on. But my area of interest is theory and practice. I love theory. I love reflection. It's why I'm passionate about that why question, because that's where theory comes in. It's where reflection happens. It's the most powerful question we can ever ask. So because theory is really, I'm really interested in it. When I've started to really dig into kindness, I started to talk about it on a bit of a surface level. And then the more I talked about it, people said, oh, that was really interesting. I was thinking, well, it's just kindness, isn't it? But the more I thought about it, the more I thought it is really important. Where is it in the theory base? What's the knowledge base say? So I've started to hunt a bit for it. Now, obviously, I'm fortunate because books that I've written, I can search really easily. I can do, word finding on. It's really hard to do it on other books because you don't have that same kind of editorial access. But I was thinking, right, theory, right, I'm going to have a look at that. That's a lot of students use theory and practice, social work textbook. I'll start off by, it must be in the theory somewhere. So I'll do a search for the word kind, and it does appear 9 times. And I thought, okay, that's good. It's not very many times, but that's good. But then when I started to look at, none of it is in the context of kindness. It's all in the context of, you know, it says this kind of theory, this kind of people, this kind of things, this kind of structure. It's all about that. Never kindness. And I was really it really made me reflect. I thought, it's a book I've written and I'm talking about kindness is really important, and it's not there. But then I thought, well, actually, this book is just a summary of theory. So maybe the theory's not there. I can't inject it in if it's not there, because this is a summary of theory. And kindness just is not there. So then I had a look at other places. I went to have a look at this, share. Lots of you will be familiar with share. I was much happier when I took a look at this one, because the word kind appears 44 times in there, mostly in the context of kindness. A lot of the times, it's the stakeholders that contributed. It's the practice educators, it's the students, it's the people who've used services, it's the social workers who contribute in the book. They use the word kindness. Once it even appears in the context of kinder transport, and I was thinking, that's very relevant to what's happening today, isn't it? Kindness. So it was interesting on reflection that I developed with Joe Finch and Prospero Ted, and both names that I'm sure you'll recognise from practice education. We developed share as a model for practice educators. That's where it came from. The 3 of us decided we wanted to develop a model that practice educators could use in their work with students, but also in their work as social workers. So we developed it for practice education, and the context of kindness, you know, it was in there already. Even before I was working on this idea of where is kindness, it was there, and that made me feel good. You know, great, we put kindness in there because it really matters. I started digging more deeply. Where do you really find kindness in the social work literature? And it's in books like these. That's where you will find kindness referred to in plenty. Books written by people using services, books written by parents of people using services. That is where you'll see the word kindness. Now, I don't have the option, because I'm not, you know, I don't have that edit function to be able to count how many times the word kindness appears in those books, but it appears so many times. That's where you'll see it appear. In the knowledge that comes from people using services. It's not coming from the profession. We don't see it in the knowledge base from the profession. And that matters. Just that understanding of that. This is a book which is due out next month. You might have seen the book called Outlanders, Hidden Narratives of Social Workers of Colour. This is follows up from it. Insiders, Outsiders, Hidden Narratives of Care Experienced Social Workers. It's an anthology which contains a range of reflections from care experienced social workers, from students. I mean, it starts off with someone who wants to be a social work student, saying why they want to be a social worker, and it goes through to people at whole ranges of experience on their social work career. They grew up within the system. They grew up in children's services. They've got all that insider knowledge, but now they feel like outsiders within the profession. I cannot tell you, in editing that book, how struck I was by the oppression faced by those social workers. In our weekly webinars, the Wednesday night webinars, we've got a webinar tonight made up of care experienced students and social workers talking about the oppression that they feel that they face. As a practice educator, reading the narratives included in this book have really made me reflect. And in the introductory preface, This is something that I wrote. I can't put what page number because the page numbers are still all altering before it goes to print, but this is what I wrote about kindness. I've literally been hunting for the word, and I've just shown you the way that I've been hunting for the word. Everything I look at now, I'm looking for the word kind. You will find kindness here. I found it here. The word appears in the narratives in this anthology 18 times, and that is what insider experience provides. What matters is sometimes difficult to measure, and unfortunately, I think in social work, we've allowed the focus to move more towards what's easy to measure. Love and kindness matter. They're difficult to quantify and they're hard to process in data, but this anthology shows how kindness impacts and how it can, in fact, be a life and death matter. I'm going to encourage you to take a look at the narratives in that book, which will be due out in April. It might be early May, but. And then I'm going to take you back, having explored all of that, having said, look, you're just not going to find the word kindness, although I'm pleased it is in Share. I can't find the word kindness in social work theory, in literature. We might think it's there, but we go looking for it. It's just not there. But we find it in different places. And that reminded me of the international definition of social work. I want you to look at this differently. You've probably looked at this definition hundreds of times. It says that social work is a practice-based profession and an academic discipline. It promotes social change and development, social cohesion, and the empowerment and liberation of people. Principles of social justice, human rights, collective responsibility and respect for diversities are central to social work. Underpinned by theories of social work, by social sciences, humanities and Indigenous knowledges, social work engages people and structures to address life challenges and enhance well-being. And the Indigenous knowledge in social work that comes from people who are experiencing social work talks about the importance of kindness. Yeah, it's not there in the knowledge base. So why is that? We're going to explore it a little bit more. What I'd say to you is, though, in doing all of this literature search, in hunting around for the word kindness, the irony is it's there in nursing and healthcare. They've written a lot more about kindness and compassion in practice. I'm not suggesting it means it's more there in the actual practice, because I don't believe that. But it's more there in the knowledge. It's written about. They've also got requirements around standards, around kindness in their standards of practice and their codes of conduct. You'll see the word kindness appearing in NMC standards. And just as an example, just to show, doing kindness as a therapeutic intervention. I mean, I love the title of that article. Kindness can be a therapeutic intervention. We don't have to look at intervention as always about service delivery, but it can just be about kindness. And that's starting to be recognised in the literature in nursing and healthcare. It is still not there in social work literature. It's just not in the textbooks. I can't find it in any of the social work standards. I've looked at the professional capabilities framework, every single layer, from entry to social work up to strategic management in social work. I can't see it. I've looked at the knowledge and skills statements. I've looked at the supervision standards. I've looked at the PEPs, post-qualifying standards. I've looked at AMP. I've looked at DOLS. It's not there. It isn't there. I cannot find it anywhere. And yet, surely kindness is relevant in the purpose of social work, the practice of social work, and the impact of social work. So I suppose the question I'm posing is, the tradition, the song is called "Where is the Love," isn't it? Where is the kindness? Where's it gone in social work? It's there in practice, but it's not there in the literature. And because of moral injury, we need to think about it more. So that's what we're going to do this afternoon. We're going to think about it more. We're going to think about what we can do as practice educators around kindness. One of the things that prompted me into really thinking through kindness is that at the start of the pandemic, I worked with a group of students. I was practice educator to 5 students quite early on in the pandemic, and I failed one of those students. And it really made me think about kindness, because I was talking a bit about kindness at the time, only a little bit, but then I was thinking, I bet that student doesn't think I was kind. And I started to explore, how do we do really difficult things with kindness? Because kindness is so important when we're doing things like making recommendations that students should fail. How do we do all of this stuff when it's not there? There's nothing to refer to. We tend to only go and look at the literature when we need it, when there's something happening. Oh, do you know, we need a bit more kindness. There's something needed there. Where's the literature? Where's the standard? It's not there. So that's my view, is I've not been able to find it anywhere. So I've been trying to work on it. I'm working with Caroline Aldridge, who I'll tell you a little bit more about later, and we're trying to develop some theories and ideas around kindness and gifts of social work, because for us, social work, kindness is a gift. It's a gift to give and a gift to receive, and it sits really clearly within social work. So I've just started to introduce thinking about what is kindness, but I'm going to ask you now, we're going to take a short break away from the screen, just because it's, I think, good practice to do that when we're sitting looking at screens all day, but you're going to do an activity whilst you're taking that break away from the screen. This is what I'm going to ask you to do. Building on the language of things, the language of objects, you know, Claire Winnicott's work on third object theory. We use objects a lot in social work, like objects of reference that we use. Mark Dole's project, Social Work in 42 Objects, is a really great project. I don't know if you've got students to get involved in that, but what Mark did was he asked a range of different people how they would describe social work in an object. So what object to you represents social work? And he set up a website, originally called Social Work in 40 Objects, because that was his original aim. He's got hundreds of objects on there now. But if a student comes up with an object and they send it into the project, Mark will put it up on the website. And it's a really useful kind of technique and tool to use with students to get them to think about, what is social work? How would you describe it through an object? I use loads of objects in supervision with students. I'll tell you a little bit later about how I use objects with students and my use of objects, particularly in supervision. But what I'm going to ask you to do is take a little bit of a break away from the screen. I'm going to stop screen sharing now and hopefully come back to the group. Hopefully, there we go. I'm back in. Okay, so what I'm going to ask you to do is find an object of kindness. I'll tell you why later. We're going to come back to it later, but I would like you to take a bit of time away from the screen. So I'm making it, by the time we've finished kind of introducing it, it'll be about 5 to 2. So I'm going to ask you to come back at 2:05. So if you look at the clock, we synchronise our watches now. 2:05, come back with an object of kindness. And this is where I'd like a few people to put their cameras on and show us their object. Tell us about the object. Tell us why it is for you an object of kindness. Now, what this is doing is it's opening up different thinking styles. It's giving us a different way of exploring what kindness means. I'm hoping while you're away looking at your objects, I'll have a quick look in the chat, but I'm hoping that in the chat you've described, this is what kindness means to me. This is what kindness means. I'm going to ask you now to find an object, a kindness object. So what I want you to find, an object of kindness. I want you to bring it back. Now, if your object of kindness is, I don't know, if it's the fitted wardrobe in your bedroom, obviously it's too big for you to bring back to the screen. Fair enough, don't bring it back to the screen. but just tell us about it. I'd like everybody to go and find an object, bring it back. Some of you put your cameras on, show us the object, tell us why it's an object of kindness. Other people, I'm going to ask you to put your object of kindness into the chat. I'm loving the fact that people are sharing in the chat things that you've found. Mental health org, fabulous. It is, absolutely comes out of the nursing side of kindness. Janine's talking about Brené Brown saying being clear is being kind. Absolutely, Brené Brown does have a little bit about kindness, not necessarily in the theory base, but that courage stuff. We're going to come back to that, but it is hard to find. It is hard to find in detail. So go off, find yourself an object of kindness, and at 2:05, I'm hoping that we can have some cameras on and some people showing us their object of kindness. Okay, I can see people already coming back with their objects of kindness. I was also wanting to allow you a bit of time for a comfort break if you needed it. So, but I can see people coming back with their objects of kindness. I also agree with Catherine, and it looks like Ellie is also agreeing. There are many situations where kindness isn't there in nursing practice and healthcare practice, and certainly I have experienced that being on a hospital stroke ward for several weeks after having a stroke. I experienced a lot of unkindness, mostly from the people who were the most highly trained. The kindness came from the people who had the least amount of training, actually, in my experience. So the cleaner on the ward and one of the healthcare assistants I remember as being hugely kind. Some of the nurses I remember as being very unkind. So interesting. What's that say about what professional training does for us? So because I'm saying that it's written about in healthcare and nursing, I'm not suggesting it's there more. I'm just pointing out it's written about, and we just haven't written about it. And I think we should, because I think it's missing from our literature. And I think that means it's Pauline asking, do we train kindness out of people? It's a very good question, and one I'm going to pose in a little while. I've got a slide that absolutely basically says that, so I think it's interesting for us to explore. We've got some fabulous objects coming back in the chat. Look, Graham's gone for a brew. I love that. Doesn't even say a cup of tea or coffee. Doesn't even say what brew it is, just a brew, and that's very actually, because I grew up in Droylsden, that's a very Droylsden word, isn't it? It's just a brew. So there's a brew, we've got bath bombs, I like the dressing gown object, hot water bottle, lovely, little notes written by daughters, fabulous. A tub of dreamies, the cat adores them, marvellous. Look, I've got people holding things up at the, trying to just move this. Who was that was waving? What's that like Danish pastry being waved at us? Put your mic on and tell us about that, and then Lorraine can tell us about her pucker tea. But go on, tell us about your Danish pastry.
Oh, it's just in our kitchen, on a team day, our manager brings in loads of pastries all day, and it's just that, I think she's a feeder, but there's a real culture in our organisation about bringing food, and it's always received in kindness.
Yeah, absolutely. Food is often about kindness. Lorraine, tell us about your tea bag you're waving at us, your pucker tea bag. Tell us about that, Lorraine.
Yeah, so one of my colleagues always puts tea bags on my desk because he knows that I like them, and so we've just kind of gotten into the habit of giving each other tea bags on our desks, just different flavors and things like that, which is really sweet.
Yeah, it is. That's lovely. Lovely. Thank you, Lorraine. Who else has got an object you'd like to physically show to us? Helen's waving something at us, and then I can't see who it is because it's all covered up, but somebody's waving a picture of a bee. So let's have a look at Helen's, and then let's have a look at the bee. So Helen,
I started to think of loads, so I've gone through quite an easy one. So during lockdown, a few of me and my friends kind of sent each other little things, and my sister sent me, it's a hugkin. So it's a pumpkin with a hug around it. So she was very anxious about COVID. So even when you could meet outside, I didn't see her for a long time. So she sent me a hug in the post, and it's by my bed, and it feels nice. But yeah, I've got quite a few, so it's hard to pick one, but this one's lovely.
It's lovely, thank you, Helen. Who's showing us the bee? Who's that? I can't see your name.
It's Claire.
Oh, Claire, hiya, Claire. Sorry, you stuck behind the big thing that says stop spotlighting me, so I couldn't see it was you. Go on, Claire.
No, it's me. I found this is absolutely brilliant. I found it. I was walking to the University of Manchester during the lockdown, and somebody had left it on a bench and just said, "Help yourself." And at the back of it, it says, it's got a little saying. It says, "Always remember, you are braver than you believe, stronger than you seem, and smarter than you think." And I just thought it was just in the middle of lockdown when we all felt so low and just kind of really burnt out, just to have that little thing. And it was just put there randomly for people to pick up. And I've got it, and I'm, got it right at my desk, and it's a lovely reminder.
Yeah, lovely. Thank you. Claire, tell us about your your Batman figure and then we'll move on. But I'm like, Pauline, oh, Boy in a China Shop. I love Keith Brimmer-Jones, so I'm going to get that. I'm like, oh, I'm going to get that. Tell us about your Batman.
My Batman, yeah. So I had a student last year in the pandemic, and we were the dream team, and we called each other Batman and Robin, but we both wanted to be Batman. So when he left, that was my gift.
That's fabulous. That's a lovely story as well. So thank you for that. Okay, put us loads more objects coming up in the chat. It's lovely, isn't it, sharing objects? You also learn quite a lot about people in quite a short space of time, and objects can really demonstrate kindness. I wanted to just tell you a little bit about this as well, actually. And I'll send a link to it later, but Threads of Love, I don't know if any of you have seen this, it's a new project that started, Threads of Love in Care, TLC. It's a project started in memory of Paul Yusuf McCormack. It's a network of people who will sew or crochet or knit, like the hug that you had, the Hearts for Hands, Comfort Critters, handmade heirloom knits for the babies of care experienced parents. It's all about, so 2 things will be knitted, 2 love hearts that people can hold who are going to be separated from one another, perhaps siblings, or that they can take with them, threads of love in the care system, and they're objects of kindness. So objects of kindness can really matter, but very often objects of kindness relate to the story behind it. When you were talking about your objects, none of you talked about an object just alone. You all talked about people connected to the objects. So we heard about the tea bag wasn't just a tea bag, it was the colleague leaving the tea bag. The Danish pastry wasn't just the Danish pastry, it's the manager leaving the Danish pastry. I'm going to return to that when we come to the end of the session, and I'm going to think about why that is. But think about your object of kindness. The little hug was about sister, wasn't it? There was a story of a person. The Batman was the story of the student. There's a person behind the object. It's that matters, the person behind the object, and we're going to return to that later. But I use objects a lot. I'm going to go back into screen sharing to try and just, hopefully, if this is going to work this time, to continue with where we were. That's where we were. Look, objects. I use objects a lot. I use it particularly as a technique to open supervision, and I really enjoyed reading the chat in that little bit of where I managed to get a break to look at the chat and could see people talking about restorative practice, check-ins, the importance of asking people how they are. Really, how are you? And this is what I use an object for. I use it to open supervision because I think it's really important that we stay with feelings for longer at the start of supervision. You know, sometimes people will say, how are you feeling at the start of supervision? But you know that the only reason they're doing it is so in their head they can tick off, okay, I've done the support function of supervision, now I'll move on. I've even sat and observed supervision session where somebody said, okay, we've done well-being, now what's next? What's that actually saying? We need to stay with feelings for longer. So I do that. I say, start off, I mean, sometimes I ask people to bring postcards. That's a technique some of you might have done with me before. I also ask different people to do the start in different ways. But what I've been doing recently is ask people to bring an object to the start of supervision, to share with me, to tell me about how they're feeling using the object. And you get to know a lot more about the person quite quickly. But to give you an idea, I was just thinking about the tea bag that we had earlier. Somebody bought a tea bag to explain how they were feeling, but it was a used soggy tea bag. They said, I feel a bit like this. I feel like I've been wrung out. Everybody's had a go of me and there's nothing left to give. Helping people to think about how they feel through a use of an object is really good. It can take you can revisit the object throughout supervision and it can work very well. So objects, we've looked at objects of kindness. We're going to return to those objects of kindness. But we're going to ask what might seem like on the face of it, a really basic question. Why is kindness important in professional practice? Well, you know, we kind of take it for granted, I suppose. Why is it so important? Social work is stressful. We know that. We know that we are, as social workers, particularly vulnerable to work-related stress. And that's been demonstrated through research over many, many years. COVID has had an even more significant impact. And I think the only antidote to that is kindness. I think we've got to bring kindness in, and that is being recognised again, going into the literature in the health service. This was written about the healthcare response to COVID-19 in the NHS in Scotland, written by Ben Thurman. It's called The Courage to be Kind, because it shows it takes courage to be kind. The document talks about there being a huge amount of opportunity for us to deliver relational services since COVID. It says we've taken away performance management and micromanagement, fostered creativity and working together, and there's been a real cohesion between previous turfdoms. But it's all about celebrating kindness, the good stuff that's happened. And in that document, it gives us a very clear why. Why kindness? Well, Ben Thurman's document shows it's really important to be kind to staff. Otherwise, they won't have the reserves to bring that into their work and their interactions. If you've got staff that are being looked after, this will permeate into how they are with, he says, patients. I've changed it to people. Some of you said in the chat, basically summarising Maya Angelou's quote, people will forget what you said. People will forget what you did, but people will never forget how you made them feel. We have to be able to do difficult things with kindness. And yet I think we struggle with it. I do think we struggle with kindness in social work. And that, again, another question for you. Why do you think we struggle with kindness in social work? Maybe you think we don't. Lots of you were saying earlier, you know, well, we've got kindness. And yes, I do see kindness in social work, but I also see a struggle with kindness in social work. And I've said to you that I've been doing a lot of work on this recently, and I was going to share with you some of the things that people are telling me. And this is one of the things that I want to tell you, not from the Manchester region, but a newly qualified social worker told me just last week. I'd done some work with a group on kindness and the theory of kindness that I'm still working on. And she said, thank you so much for doing that. It's really helped me to think things through, because my manager told me I'm too kind to be a social worker. We're going to need to knock that out of you. That is what a newly qualified social worker was told by her manager. You're too kind to be a social worker. We'll have to knock that out of you. What have we become? What have we become when the future of our profession is being told you're too kind? I wonder whether, and maybe the question that you posed in the chat, I can't remember who it was now, but you know, do we train people out of kindness? I think maybe you've put it in a better way. I said I think kindness is a virtue, and I think virtues are not valued within social work. You know, virtues like kindness were the foundation of social work. But I think one of the negative side effects of us moving towards the professionalisation of social work, which I've seen a lot in the 32 years since I qualified, some of that professionalisation has been really positive and really good. Some of it hasn't been. Some of it has been just a move away from fundamental virtues towards professionalising. And maybe that's why I think we need to have theory included in our knowledge base. If it wasn't all about, well, we've moved towards that, I'd be like, well, okay, it doesn't matter because it's there anyway, and it's just a fundamental part of what we do and who we are and how we go about things. But actually, as we're starting to become more professionalised and be more focused on meeting standards and all of that, if kindness isn't in the standards, we're going to lose it. We will train people out of kindness. I wonder whether we're too focused on measurement. We have become focused on what is easy to measure. How many cases have you got? When are you going to do that by? Have you done this? Have you met, you know, we've got to do timescales. It's all about data crunching. And what is really important is often difficult to measure: the quality of a relationship, the way that an interaction leaves a person feeling. That never makes it into the data that's being reported. I do think that the move in practice education towards holistic assessment, moving away from what had become very tick boxy. You know, I mean, I've been a practice educator for so long. I was around when we were called a practice teacher, then we were called a practice assessor, and now practice educator. And I've been through all of those stages. I've been through all of the different standards. You know, I can still remember that Unit 8 was group work and Unit 11 was, I think, crisis intervention, and Unit 12 was, you know, I remember all of that stuff because I was seeped in it, the box ticking approach. We are moving away from that, and I think that that's helped, but I think we've still got a long way to go, and I think we are too focused on measurement. So these are some of the reasons I think we struggle with it. I think the professionalisation, I think we're too focused on measurement. I think we've got a deficit. You know, I think kindness is completely immeasurable. And so it's almost, or it's not on the agenda. Senior managers don't want to know about it because we can't measure it. We can't report it to government. Can't get funding based on it. Harry Ferguson's research is one of the places that you will see kindness referred to in social work literature. Harry says that consistently his research, which is very practice focused, I think it's some of the closest linked to practice of any research in social work, and he says that his research consistently illustrates the kindness of social workers. But his argument is we operate within a deficit culture, so we don't always value and recognise the value of our kindness. We don't always see it. But I think we need to reclaim it. This is a picture not about kindness, but this is a picture taken from the Reclaim movement in Moss Side around Black Lives Matter. But I think it's really important to look at reclaiming stuff. It's the same. And it's connected to anti-oppressive practice. All of this. Be strong, power. I think one of the things about kindness is it's seen as a weakness instead of a strength. Kindness is power. It takes strength to be kind, and it is fundamentally linked into the foundations of what we do. I think we've really got to reclaim it, be proud about it. But there's lots of issues. Students haven't been together. Lecture theatres have been empty. There was a lot more kindness in social work training between cohorts when one of them would say, yeah, I'll go buy you a coffee, or here's a tea bag, or all that stuff. That's much more difficult when you're remote, when you've never met the people that you've trained with as a social worker. Students have been learning on teams, on their own, isolated, away from people. And that's impacting on kindness. These are a couple of photos taken from the students that I do the webinars with. I'm learning a lot more from them about student life, I suppose, more than I do as a practice educator. When you're a practice educator, students know you're assessing them. So there's always going to be that element where you don't quite get the full experience from them. But this group of students, because we work together, we are a team, and I do think, there's more honesty in the team. And these are two photos taken from the team. We've got a WhatsApp group. At the start, when we first started to work together on these webinars, it was right at the early stages of the pandemic, and all of them had their placements suspended. And that's, one of the reasons we came together. But the first one that was due to go back on placement said in the WhatsApp group, I'm really excited. I'm going to meet my practice educator. I'm going to see, my placement. And everyone was going, oh, it's great, great, great. Tell us how it goes. Tell us how it goes. She couldn't, she said, I'm going in now, in the WhatsApp group. Couldn't have been 10 minutes, 15 minutes later, she posted this photo and said, well, it wasn't that great, actually. I met my practice educator in the car park. She gave me this. This is my induction pack. Is that what we'd have thought an induction pack looked like a couple of years ago? But that's an induction pack. This is what students are experiencing. Lots of students, maybe not every student, but thinking about lots of students. She said, but I'm not worried. I'm not worried. It's going to be okay because they know how important it is for us as students to learn from one another. So we're going to be going into the office 3 days a week. And everyone was like, oh, great, great. I'm so excited for you. I'm so excited. On the third day, she sent me this picture. She said, I don't want to put it in the WhatsApp group because I don't want to bring the mood down. But I've been in the office for 3 days and this has been the same view. It's not the office that matters. You don't learn from being in an office. You learn from the people that surround you. And where people are remote from one another, that's where the kindness can be impacted. And remote working definitely creates particular challenges. This is an illustration of my first experience of working with a student on supervision on a computer where she started to cry. I didn't know how to handle it. I remember it really, you know, I used the head, heart, hands to reflect on it. I wrote a blog about it and the student wrote a blog about it from her perspective when we put the blog up together on my website. It was an interesting learning experience. But all of the actions that I would normally have done, if a student cried in supervision, I had like a whole range of tools I could use. There'd always be tissues in my bag. I'd maybe say, I'll just go and make you a cup of tea. All those things, can't do them. Can't do them when it's online. Acts of kindness need to become different. So we're struggling with it because everything's changed. It's all different. And we're also struggling with it because we are exhausted. Caroline Aldridge's book, if you've not read it, get it. It's the best book I have ever read as a social worker, called He Died Waiting. Caroline says this in the book: I don't think I was as understanding or kind as I could have been because I'd run out of empathy. My own reserves were drained. I felt trapped, bombarded by other people's pain. And a lot of social workers feel like that at the moment. When you're close to burnout, it's much harder to be kind. It's what I see as the snotty email syndrome, I call it. There's so much exhaustion in the profession. People really struggling with moral injury, burnout, compassion fatigue. It's so hard to be kind with all of that going on. For those of you who haven't done anything on moral injury with me, I'm just going to show a few slides now. They could be very distressing for you. We're going to take a break after them so you can go and get a cup of tea or a brew. And do use your object of kindness. Wrap yourself in your dressing gown or eat that Danish pastry or whatever it is. Because you need to be kind to yourself when you think about what people are dealing with at the moment. So all of these quotes are real. They're not made up for training purposes. This is what people are saying about work recently through the pandemic. Some of these are quotes from 2 years ago, right at the start of the pandemic, and one of them is from just a fortnight ago. People saying things like, here I am doing death and dying, sitting at my kitchen table. It feels very different from here, right at the start of the pandemic. People talking about my own children are hearing all of this trauma. Doing what I can, but it's never going to be enough. I keep on asking myself, how am I ever going to get over all of this? Students saying, how are you supposed to learn about your profession sitting in your bedroom in the middle of a global pandemic? I feel like I'm just watching it online and it isn't enough. A newly qualified worker who'd been 6 months into the job and still didn't know how tall anybody was. She'd only ever seen her colleagues online, and there are people like that now. People feel the home has been invaded. They never want to come in this room again because of the things they've seen and heard and done in here, giving evidence in court in your bedroom. An adult social care worker who told me, I'm haunted by what I did. This couple were married to one another for 72 years and they never saw each other again after my intervention. People feeling abandoned by social work leadership. People asking themselves, why did I do what I did at the start of the pandemic? Loss after loss. All of this death that we were surrounded by and dealing with. And just a couple of weeks ago, the social worker told me, working from home, she knew she had to do a report on something. She knew it was a big case file that she had to open. She thought, I'll just go and sit in the front room and sit on the settee in a comfy place while I just read this case file. She said there's no warning on it. There was nothing to alert me to the fact that I opened it and I read about the most horrendous child sexual abuse that I've ever read about. 2-year-old children. And I was sitting surrounded by my own 2-year-old daughter's toys. And I thought, I brought this into my house and infected it. Just think about what's going on in social work at the moment. And the way it can feel for people. And all of that is moral injury. I've been doing lots of work on this, so lots of you have probably been to sessions with me on it, but if you've not, I wanted to put this into the slide. It explains the concept of moral injury and the impact and what moral injury can do to people. And I'm not going to go into that in detail today because that's for another session, but what we do know is that the research suggests a number of things that can mitigate moral injury. A sense that you belong to a team, a strong reflective culture, good quality, emotionally supportive reflective supervision, the opportunity for in-depth reflection with a particular focus on feelings and emotions, education about the potential for moral injury, permission to talk about it, and a clear recognition of the importance of your work and value being placed on it. That's what the research says impacts on moral injury. In practice, I think kindness is key. Kindness impacts on moral injury. But then when I've looked at this slide, maybe those components are kindness in action. Recognising the work that your colleagues do and placing value on it is kind. Team working is kind. A strong reflective culture, good quality, supportive reflective supervision, focusing on feelings and emotions, it's all kind. So we've done the what and the why of kindness. We've started to look at, I think we're struggling with this. I think we've got to reclaim this. Contemporary practice where we're working remotely from one another, where sharing tea bags and Danish pastries and all of that is so much more difficult. The stuff that was informal, incidental, just happened, we've now got to formalise. And in the same way, I wonder whether we now need to formalise the role of kindness in social work and the importance of it. So we're going to look at the how. In the second part of the session, we're going to look at how do we do it. And do you know what I think is so fascinating? I said at the beginning of this, if we know what something is, it helps us to do it. The what and the how are intrinsically connected. And when I went back and read the chat, and I asked you what is kindness, loads of you talked about not what it is, but how do we do it? A lot of your what kindness is chat was actually about acts of kindness and how we deliver it. So I'm going to stop screen sharing. I know that what we've talked about there is really difficult stuff. Normally I spend a lot longer on that and on the concept and idea of moral injury, but I know that I've done lots of sessions across Manchester on moral injury, so I know lots of you might have done it, and I didn't want to repeat it too much today. But equally, I can't talk about kindness without talking about moral injury. Go back to the dictionary definition. The dictionary definition says kindness is about moral action. Moral injury is about when you're prevented from taking action, which is morally what you want to do. So these two things are totally linked together. So we're going to have a tea break because that's kind. It's important that we take a bit of time to have a tea break. If anybody wants to put your cameras on and come back with your cup of tea and have a little chat across the tea break, that might be kind, you know, because sometimes people go off for a tea break, but you're on your own. Maybe you don't want to be on your own. Maybe you want to sit and have a chat with somebody about your tea break, and that's fine for you to do. So feel free, you don't have to leave and switch off and go somewhere. I'm going to go and grab a cup of tea and then I'm going to come back. So if we want to chat, you can chat. It's 2:30. At 2:45, I'm going to start the presentation again with my ideas around the how of professional kindness, and that will bring in the stuff about theory, and you can throw in your ideas in the chat, but I'm hoping I can bring back some thoughts of things that you can do in the chat. But don't feel that you've got to go away for this tea break. You can sit and have your tea break together because that's kind. I'm just going to go and get a cup of tea and I shall be back in a moment. But I'll start the presentation again at 2:45.
Hi, Siobhan. Can I ask you a question?
Of course you can, Laura. Absolutely.
I was just sorry, I can hear myself. I don't know why that is.
If I go, I'll go
So
on mute.
off-putting.
It might be
Okay.
that. I'll go on mute.
Thank you. It was just about the slide that you had up that had some research on around some of the primary reasons that students might have struggled in placements. Was that in your PowerPoint, or was that the one before? That might have been the one before. Right. Okay.
Yeah, that's not mine. I think
oh,
that might be somebody. So if someone else will probably be able to answer that question for you.
Okay,
Rachel,
sorry.
you've popped up. Can you answer it?
It was all, oh God, I've got my headphones on my phone.
Go on mute.
That was Audrey Ralston, Dr. Audrey Ralston, and she's going to share the slides with us. So we'll make sure those slides are shared with everyone. Was it who was it? Can you remember anything about it in particular?
It was a graph around some of the reasons why students might end up failing placements, and I think one of them might have been around the role of a social worker and the understanding of that role. And some of the difficult. And I wanted to. I'm writing an assignment at the moment for my second part of my practice educator qualification, and I wanted to kind of integrate some of that into it. But I couldn't think what the research was, and I couldn't find anything online.
Well, what I'll do, so that research is actually Audrey's and two of her colleagues.
Okay.
So I've got the links, and I'll Google them and I'll put them in the chat, so you should be able to see. Oh, Audrey.
I'm still here.
It's lucky I was saying nice things about you.
Yeah. No, I can send the links. I'll put the links in the chat for the papers that have been published out of that, and then you can just cite the papers. Is that okay?
That'd be lovely. Thank you. Yeah.
No problem.
Thanks, Audrey.
Hi, Siobhan, can I ask you a question?
Hi, Debbie, of course you can.
I just wanted to ask, how would you balance being kind whilst also being assertive? Because within practice, for instance, I've seen colleagues getting bullied for being too kind, even managers, just being really, really lovely, really kind, and being sort of bullied by other managers. And you know, sometimes you can go in meetings, be amongst other professionals, I'd say like doctors or consultants, and sometimes it can be quite overpowering, you know, be quite rude. And I think it can be quite difficult sometimes, like interjecting and, you know, challenging them appropriately at times. So how would do you think there's such a thing as being too kind, or?
I don't, but I'm going to come on to that. I've been trying to look a bit at the theory base because I'm just trying to get that foundation, really. And some of these questions are all questions I'm trying to take in. And there is something in that I've found useful that we're going to talk about in a little while about that comes from philosophy about the difference between being nice and being kind. And I think you can be too nice, but I don't think you can ever be too kind. And I think that can help us to, because I completely agree with what you're saying there, Debbie, that sometimes, you know, other people aren't always kind. And, you know, that can sometimes, I suppose, it's that bit about our own communication levels, isn't it? Just because somebody becomes more aggressive with us doesn't mean we become more aggressive. So we don't need to become unkind just because somebody else is being unkind. But I think we can be too nice.
Okay.
And so I think I'm going to look at that, because I found that really helpful at what's the difference between being nice and being kind. And that, I think, has helped me to recognise you can never be too kind. So yeah, but I do get what you're saying about that we need to balance how can we be professionally assertive, but I think we can do that in a kind way, really. So I suppose that's what I'd say. I'm hoping that in the next part of what I'm going to share with you, that might come through. But I think it's still stuff that I'm struggling with. It's still stuff that I'm toying around with. And I think it's only when you really start to think about it, because kindness is just something you do just think is there. Don't you just think it's there and you almost just take it for granted. But when you start reflecting on it and thinking about some of the challenges that we've faced, you know, in COVID, and then some of the things like conflict in working with others, you start to realise it's not always there. So how can we bring it to the fore a bit more? So I don't know if I've got a full answer, but maybe I suppose it's that bit about working on being assertive rather than being aggressive, which is obviously unkind. Assertive can still be kind, can't it? Or you can still be kind whilst being assertive, I think. Yeah, I suppose that's what I'd say. When I come to the being nice and being kind thing, see if it comes through that for you.
No, you've made sense, to be honest. Thank you.
Okay, thank you. Oh, Lisa is asking.
Siobhan, you've muted yourself.
Yeah.
Great.
Yeah, I muted myself. I wasn't saying anything. Sorry. Was I talking to myself? I might be talking to myself and you thought I was saying something, but no, I wasn't. Once I'd finished chatting, I'd muted. Is that all right?
Yeah.
Yeah, okay. I think I was talking away to Lisa, and then I realised actually there's no point me talking to Lisa because Lisa's put it in the chat, so I'll answer her in the chat. So that's what I went and did, but I chatted to myself whilst I was doing it. So I do talk to myself quite a lot. I like the thoughts that people are putting into the chat, like Sabine saying, you know, would it come under advocacy and respect? Absolutely. I think it'd come under assessment as well. I think it'd come under everything. But the problem is when you go looking for it, you just don't see the word there. We think it's there and then it's not there. I just think that's the thing that has surprised me whilst I've been going looking for it, you know, because in the work I've been doing on moral injury, I just started off by, you know, a couple of years ago, just putting in a couple of slides about being kind to one another and, you know, needing to just be that extra bit kind to one another. And people were going, oh, yeah, that's amazing. And then I started thinking, well, it's not. It's just basic stuff. But when I went looking for it, it's not there. It's just not there. So it's, I think you're right, Sabine, it comes into everything, but it's just not there. I tell you what, it did come into a lot was World Social Work Day theme of last year, Ubuntu. Kindness is a key part of Ubuntu. But again, just the actual word, you didn't see it in a lot of the material that came out about World Social Work Day. It's just the word. I only see the word when I'm looking at it around, as I said earlier, around people who've received services. That's where I see it. I just don't see it in people who provide services, and that's sad, I think. And Christopher, I like what you're saying there, the language around failing students. Yeah, it's really difficult. It is a harsh word, you're right, it's harsh. And if you were to think about what we would include as being kind, harsh is not one of those things, is it? So, and the word fail, and what the word fail conjures up for people, going back to the words, I suppose, with that dictionary definition where we started off, actually. So Lisa has got it on her t-shirt, in a world where you can be anything, be kind. Well, Lisa, I've got a slide, 3 slides time, that's got some t-shirts on that say that I'm going to be a bit critical about, Lisa. I'm not criticising your t-shirt. I think it's lovely. I wish you could put your camera on and show us your t-shirt. I think it's lovely. It's just the just be kind stuff that I think can be tricky, because sometimes it's really hard to be kind, isn't it? So, but I'm going to slightly criticise that whole t-shirt movement, Lisa, in a moment, because there's loads of it around. Are you going to model for us?
You can't really see it.
I've got this flipping bar across the bottom that's got the, your microphone. I can see it now.
It's got chocolate milkshake on it. Apologies.
No, the chocolate milkshake is kindness in action, isn't it? That's your object of kindness that you've done some artistic stuff with. I think it really matters. So, okay, and then Atya saying, I think it reflects the kind of language we use as practitioners overall. I absolutely agree. Kindness isn't a word that we attribute to the standards we hold ourselves and others to. Absolutely, I agree. Just think it's just not a word we'd say, really, or that we use enough. Certainly not enough. Okay, so let's make a start again then. I'm going to go back into screen sharing just to throw in some ideas, but what I'd like you to do is I'd like you to continue to use the chat in the way you have been, with some ideas in the chat around how do we do this. So how do you bring it forwards? How do we make sure it permeates? So I'm just going to continue, I suppose, a little bit with thoughts around this area that I'd see as guiding some reflection for you, having to think about it. Maybe the first thing I'd say is surround yourself with kindness. This is the view of, although I've just moved recently to Northern Ireland, and this is my office. Well, it wasn't my office, it was my daughter's bedroom that I pinched off her and took as my office. But now I've moved to Northern Ireland, I've got my own little room that I can shut the door on, and have not yet put these back up. I will do soon. But these are the things that surrounded me that I was looking at when I was working in my daughter's bedroom. So the choice of paint colour on the walls was her choice of paint colour, and then I put all this stuff all over surrounding me, because I wanted to be able to look up and see things. And some of the things there, I don't know if you can see the 2 things, putting love into social work. They were things that were made by a dear friend and colleague of mine, Paul Yusuf McCormack, who died of COVID early in the pandemic. Paul he grew up in the care system, and he was a foster carer, and he talked about the vital importance of bringing love into social work. We know that it's the Care Experienced Conference, the 10 messages for social work, top 10 messages from that conference. Number 1 was we need more love in the care system, including physical displays of affection, all the stuff about kindness. There's a postcard that often sits in front of me, taken from Caroline Aldridge's book, which is a really excellent book I told you about. And I saw earlier Claire put a link to Caroline's webinar on He Died Waiting. Love, like compassion, are human necessities that keep us in the realms of kindness. So whenever I looked up, when I was in the office before I moved over to Northern Ireland, I was surrounded by love and kindness within social work. But again, I just don't see it in the literature. Maybe it's just me, but I just don't see it there, and I don't see it as being part of what we do and we look for as a practice educator. As a practice educator, would you ever say one of the things I teach and assess is kindness, because we wouldn't. It's just not like, just doesn't sit there for us. So surround yourself with kindness. I would definitely say do that. But you know, this whole movement, just be kind, like the t-shirt that we've just seen, brilliant. There's loads of that stuff all over the place, and there, just be kind. It's the just be kind movement. It worries me a bit. You know, they give this message, it's free, it's easy, you can just be kind. Actually, it can be really difficult sometimes. You know, in that scenario that we were talking about in the tea break, where you're sitting there across from another professional who isn't being respectful, who isn't being kind, who is being, you know, interjecting and stepping into everything you say, maybe bullying. It's really difficult. It can be really difficult to do. I know sometimes when I've had a really long day and a really tough day, and then somebody sends me a message and I think, oh, for goodness sake. It's actually really difficult sometimes to be kind. So surround yourself, but don't necessarily see it as something that's simple and easy to do. What you might have seen, talking of surrounding yourself with stuff, is this is something you see a lot in schools. I don't know if you've seen it, but I've done quite a lot of work in schools as a social worker, maybe the last 5 or 6 years, and I'd be seeing this up in schools all of the time. Think, is it true? Is it helpful? Is it inspiring? Is it necessary? Is it kind? I used to think, oh, I really like that. I think that's lovely. I'd see it as a message up around lots of different schools. I like that kind bit at the end. So with the Social Work Student Connect team that I do the webinars with on a Wednesday night, we tried to do something similar around kind. And this is what we came up with as a team, because we've done a couple of webinars now about kindness and the importance of kindness. And this is what we came up with. So we're saying, rather than, often this is about before you speak, you usually get when you see this in schools, before you speak. So we did a before you act. Keep the person at the centre of your response. Think about the immediate response. Is your immediate response the best one? And we were thinking there about emails. Sometimes I do have a tendency to write a bit of a snotty email, and I've realised that in myself now. So what I'll often do is, if it's a bit contentious or a bit difficult, especially if I'm tired, I won't send the email that day. I'll draft it and then I'll read it before I send it the next day, because my immediate response isn't always kind. And then think about needs. What does the person need? Do they need to be heard, to be accepted, to be validated? So if someone is being unkind, your response to them needs to think about, what does that person need in this moment, and don't discriminate. I don't think it's perfect. I don't think it's great, but it's something that we came up with. We do this stuff quickly because we have a different topic every week. So we have to, you know, do things quickly. But I thought, you know, I'd maybe share it with you. It's something that you can do with students, is ask them, if you had to come up with something, the word kind in social work, how might you use it? And that's what the team of students came up with. I think it's pretty good, actually, thinking it through and talking it through. So how do we do it? Where's the theory? Okay, well, one night I was sitting chatting to my husband, who used to be a business studies teacher, and I was saying, you know, I've been having a look at the theory stuff today, and there's just nothing there about kindness. And I said to him, surely, you know, a bit like we were chatting about in the tea breaks, it's there in social work all the way through, but I just can't find it. You know, I'm trying to look for the word and I just don't see it anywhere, and I can't find it anywhere. And he said, the business world has got quite a bit of theory about professional kindness. And we had a bit of a giggle about that, because he often says to me about, you know, oh, you're so kind all the time. Sometimes he says it in a critical way, but because he says that's social work, isn't it? Whereas he's in the world of business, he's a bit cut. I'm just thinking about things like, if we go out to try and buy something, he's always the one that's trying to barter a deal, and I'm always like, no, just pay it, you know. And he says, oh, you're just too kind about it, you need to barter a bit. And it's like we have a joke between us about, he comes from the world of business, which is like cutthroat, you know, and I come from the world of social work, which he describes as kindness. So we have this bit of a joke between us. And then over the dinner table, we're chatting about, hang on a minute, your cutthroat world has got all this theory about kindness, and my kind world hasn't got any of it. And maybe it's that dilemma, because we think it's there, we've not written about it. Whereas in the business world, they know they need it, so they've written about it. Interesting. So he directed me to some of the literature around what's called in business professional kindness. And so Fox says this about professional kindness. Professional kindness is a balancing act of mindfulness and empowerment, made up of a number of elements that when perfectly blended together create a powerful energy. It has the ability to drive change, to influence, to motivate people, to mediate situations and to calm people, to deliver sustainable outcomes, to drive collaboration and cooperation, and to change other people's behaviours, emotions and mindsets. Have a look at that. Isn't that practice education? Don't we drive change? Don't we influence and motivate? Don't we mediate situations? Don't we try and deliver sustainable outcomes? Isn't that what it's all about? Well, it's there in the theory of professional kindness in the business world. Fox goes on to say, that's what it is. Here's how you do it. Leading by example, showing compassion and empathy towards others to manage emotions in a patient and progressive manner. Fox says that professional kindness is being open and transparent in your communication at all times and recognising it's okay not to know all of the answers. It's about encouragement and having faith in the person, refocusing the pressure from someone's inabilities towards their abilities. It's about withholding judgment to allow the possibility of new ideas and concepts and options to be freely discovered. It's about the ability to perceive the situation and be adaptable and flexible to the environment, tailoring the solution for suitable delivery. I think you can change the title of that slide quietly without anybody noticing, and it still works. I've only changed one thing. I've said surely that's what social work is. Social work is leading by example. You know, the professional capabilities framework, domain 9, leadership. It's not about management, it's about social work as leadership, leading by example, showing compassion, empathy, helping people manage emotions. It's about open, transparent communication. It's about encouragement. It's refocusing the pressure from inabilities to abilities. In social work terms, it's about strengths. All of this stuff is what social work is. And in the world of business, that is what professional kindness is. So maybe that's why we've not written about it, because it is it. Social work is it. Social work is kindness, maybe. Kindness is social work. Maybe that's why we've not written about it, not thought about it, not developed a theory around the importance of it. Theories in practice help us to describe things and explain them and predict, and that's what a theory of kindness should be doing in social work. Bartlett and Campling in 2011 wrote a book about the importance of kindness in healthcare. I know I've banged on a bit about this and how kindness is there in the healthcare literature, but they talk about rescuing kindness within the culture of healthcare provision. They refer to the need for intelligent kindness to challenge proceduralised practice and provision. I just like the idea of that rescuing of kindness, because I do think we need to somehow rescue it. But what I think is interesting is, look, in the business world, they call it professional kindness. In the health world, they call it intelligent kindness. Why can't we just call it kindness? Why do we have to kind of, you know, put something before it? We've almost got to justify it because kindness is a weakness. Some people have said that in the chat. Kindness is sometimes viewed in that sort of way. So we've almost got to professionalise it, haven't we? We've got to give some, not just kindness, because kindness is just this virtue, and oh no, we don't want to be just virtues. But really, whether we call this professional kindness or intelligent kindness, whatever we want to call it, what we need in social work is we need kindness for the people that we support as social workers, because that comes above anything. Because people will remember you being kind. And you can do really difficult things in social work with kindness. It's about being kind to the people you work with, your colleagues and other professionals, and it's about being kind to yourself. It's about all of that. So there is theory in the business world about professional kindness. I've also found quite a bit of theory about kindness in the world of philosophy. Sort of just on the edges really of philosophy, but there's quite a bit about kindness. And so I've tried to put something together. I put this visual together. I did it for one of the webinars, and I want to refine it a little bit, but I tried to put this together to show the difference between being nice and being kind. And this is where I think that question about can you be too kind, for me, and it's just my thought, and you know what I'm trying to do this afternoon is prompt your reflections, and there'll be some time for us to share and think about the guided reflections. I think it'd be useful for you to think about all of this for your Social Work England CPD as well. I mean, the conference today, I could see on Twitter I was doing something, I was in another session this morning, but I could see that there was a lot of learning coming through. And I've picked up some of the things off Twitter about the learning that you had from Audrey's presentation, but especially about feedback on students. But thinking about, can you be too kind? My view is no. It is just my view, but I don't think you can ever be too kind. I think you can be too nice. I don't think you can ever be too kind. And so I've tried to pull out the difference, because philosophy talks a little bit about this and some of the areas around what is the difference. And being nice is like not wanting to rock the boat. Do you remember that at the beginning of the pandemic, everybody kept telling us we're all in the same bloody boat? I've called it the bloody boat now. I'm fed up of hearing about it, because we've never been in the same bloody boat, have we? Politicians were in a party boat that they didn't invite anybody else onto. We've not been in the same boat. We know, don't we, that crisis exaggerates inequality. So we've never been in the same boat. Being nice is not wanting to rock the boat. Being kind is being willing to rock the boat and make waves where it's necessary. Being nice is being most concerned with not upsetting somebody. You don't want to upset anybody, so just be nice. But being kind is being most concerned with doing what's right. Being nice is trying to climb the social ladder. Being kind is lifting someone else up the social ladder. Being nice is being afraid to speak up when you witness unkind behaviour. Just keep quiet. But being nice is being ready to speak up and take a stand against the unkind behaviour. Disruption is kind sometimes. Being nice is when you worry about being liked. You want people to like you. But being kind is when you worry about being kind. Being nice is surface and easy, all of that stuff. It's dead easy being nice. But actually, being kind is deep and complex and layered and really hard to do sometimes in the difficult world of social work. So there's a key differences between being nice and being kind. But one thing, and one of the reasons I asked you earlier to bring an object of kindness, and I worded it in a very specific way. I didn't say bring an object that represents kindness to you. Some of you did, but I just said bring an object of kindness. And actually, this is when I was reading some of the stuff in philosophy, this is what is so simple, but it blew my mind. The philosophy tells us things can be nice, but only people can be kind. When I asked you to bring an object of kindness, you were talking about it. On the whole, the objects represented people. It wasn't the object really that was kind. It was the person who gave you the object, or it was the intention behind the object. Things can be nice, but only people can be kind, obviously. But it blew my mind, that, because I was thinking, well, we are people working with people. So it's kindness has got to be there. We've got to be more than nice. We've got to be kind. It's not about being nice. So I'm just going to throw into this how part now, just a few thoughts. And then I'm going to open it up so that we can have some conversations about this and about your thoughts around what I'm sharing with you now. One of the things I think it's important for us to think about is that we can take a person and environment perspective and apply it to anything, you know, because it's what we do, isn't it? As social workers, we think about the person in the context of their relationships, their community, their society. In the same way, we should think about a social worker in the context of the team, the organisation, the profession. We should think about a student in the context of the placement, the university and the wider profession. I've just said to you that things can be nice, but only people can be kind. So can organisations be kind? Can placements be kind? Or is it only the people? I mean, organisations are just people, but they're structures of people. So what about placement organisation? What about the people in an organisation? So essentially, I also want to give you some ideas of techniques and things that you can use with students and as practice educators. And, you know, I've shared a few things with you that I do with students. But one of the things I love to do with newly qualified workers is ask them if they can give me a kind of analogy or an image of what it feels like to be part of a social work team. And one of the best that has ever been done, it's probably my favourite bit of group work from training. You know, in the days when we used to be able to come face to face and you had flip charts and all of that, then this was a flip chart completed by a group of newly qualified social workers. See if you can find yourself on this. They said this is a team, a social work team. They described the community of practice that you're in as a newly qualified social worker. Let me talk you through it. In the top left-hand corner, as I'm looking at it, there's the Jurassic or the Reptile Centre. That's where they said, that's where the dinosaurs are. You know, the people they said that have been around social work for years. I'm standing there looking, coughing, you know, I've been here for 32 years. Like them, the resistant to change, there's the dinosaurs that are there. Then they've also put a chameleon in there. That's the person, you know, they're changeable. They say one thing to one person and another thing to another person. They change according to who they're talking to. Move down from there and you'll see the elephant. They said, as a newly qualified social worker, we love the elephant. We like to hold on to the tail of the matriarchal elephant and we feel like we're really going to learn from them. They're strong, they're persistent, they're really resilient social workers. They never forget anything. They're great to learn from. Then you move into the aquatic centre where they put a shark who'd eat you alive, stab you in the back. I always used to think, no, we don't have sharks in social work because everybody's kind. But now people tell me there's always a shark in every team. I'm worried about the number of sharks that I'm hearing about in social work because everybody goes, oh, yes, that's our team. Penguin. They describe the penguin as strong, dependable, protective, very focused on family life. And, you know, they said everybody wants to walk like a penguin, be like a penguin. Up in the top corner there, the right-hand corner, there's the hibernation zone. There's a big gap area. They said that describes the people we've never seen. We've been on the team 6 months. We've never seen them. They're on sick or on maternity. They're the hibernators. Then you've got Harry the Hedgehog. Can be prickly, they said, kind of prickles up if you ask them anything. There's a squirrel. The squirrel is the person who's always prepared. The squirrel, they said, is the good problem solver, good memory, great skills, always prepared. But they said the thing about a squirrel is they don't share. They've got loads of little nuggets of information, but they don't share those with you. You've got to ask them the right question at the right time in exactly the right way, and they might throw a nut at you. But generally, they said you don't get that. And as you come downwards, there's a monkey. They said every team's got a monkey, you know, the one who uses the humour to lighten the stressful mood. And every team's got a bee, a busy, hard-working team player. But they said the bee's a bit annoying sometimes because they're always buzzing about telling you how busy they are. You go down to the petting area, they said there's the sheep. The sheep's just the follower. They've no idea why they're doing what they're doing. They just do what they have to do, the follower. There's the ostrich with the head buried in the sand. They haven't got a clue what's going on around them. They've just got their head stuck in the sand. Bulldog. They said the bulldog's someone that, like, they've got a bone of an idea, but it's the same thing, and they go on and on and on about the same thing every time, every meeting. Never lets go of a bone. And then there's the chicken. They said the chicken, thankfully they didn't draw the chicken because the chicken's headless. They said that's the person who comes into the office and goes, oh, I've had a very stressful, terrible morning, splatters all their mess around everybody. Everybody tries to step in and help them, and the headless chicken goes home feeling fabulous, but they've left all the stress behind them, splattered over the team. And then there's the owl. They said the owl is, they described that as the practice educator on the team. Wise, knowledgeable, all-seeing, someone who can help you to see things from a different angle, and you always want your supervisor to be like that owl that you had as a practice educator, they said. Then there's the peacock. I've met a lot of peacocks actually over the years. Peacock looks really good, you know, got this great story to tell, they look great. But actually when the tail's gone down, they lack substance, there's nothing there. And they said as a new worker, you've got to learn who that is. They sound great when you first join the team, but actually there's a lack there when you get to know them. And then there's the zookeeper. They said every team's got a feeder, and we've already picked that up, the person who does feeding time, you know. But they said the zookeeper's also perhaps the person who goes around shoveling up all the mess that everybody else has left behind. And then finally, they described themselves as a caterpillar who, through transformative learning in their newly qualified year, their ASYE year, they transform and they improve their practice, and they turn from a caterpillar to a butterfly. They said, we know it's really cheesy, but what that means is if we don't like the environment we're in, we can fly on off somewhere else. I think that's a really lovely way of describing what a social work team feels like. But let's be honest. I said, find yourself in there. I think some days I'm a dinosaur. Other days I'm probably a bit of an ostrich. I've been so busy the last couple of weeks, I think I've just stuck my head in the sand and keeping it there. Just keep my head down, get on with my job. I'd like to think sometimes I'm an owl, maybe a penguin. I'm probably all of those things. I'd like to think I'm never a shark. But there are sharks in social work, and I keep being told this. Maybe the sharks are actually not within social work, but maybe they're about the way social work is organised or managed, or maybe it's the political nature of social work. But another how is, how do we work effectively in environments which are not professionally kind? Caroline Aldridge's book that I said to you is a brilliant book. This is one of the quotes. I mean, my copy is full of highlighter pen, but this is one of the quotes from it. Caroline says, there seems to be a prevailing philosophy of expecting social workers to be robust enough to cope with whatever the job requires. It's unsurprising that the burnout rates are so high. Apart from impacting negatively on the retention of experienced staff and being morally questionable, this attitude influences the way that practitioners work with those people who need services. Emotionally barren organisations set the tone for chains of poor emotional literacy. Leaders need to role model sensitive and attuned practice if they want their staff to treat the people who use services with respect and compassion. And it goes back to that, you know, what Ben Thurman said, how we treat staff is how they then treat people. But the bit that really jumped out at me from this was the phrase emotionally barren organisations. I'd never heard that phrase before. It's one that Caroline has developed for herself, I think, but I knew exactly what it was when I read it. I've worked in lots of emotionally barren organisations. I've sat in emotionally barren supervision sessions. We all know what an emotionally barren organisation is, but how do we create the opposite of that? How do we do that? My advice to managers in a recent session, I was trying to pull things together to share with you. I'm hoping you're putting in the chat what you think we can do. In a recent session with team managers, we were looking at how do you keep reflection, positive, because very often reflective supervision and stuff, I do a lot of work on reflection and reflective supervision. People keep focused on the negatives, what's not gone well, what do we need to do differently? So I think we need to keep the focus sometimes in reflective conversations about what went well, what people can do to continue that, to build on it. Component models of reflection work particularly well for that. If it is included in the discussion, then never end on the negative. End on a positive. Provide lots of positive feedback and commit some of that to writing. Encourage team members to give one another positive feedback. Buddy people up for reflective conversations. But rather than critical friendships, develop supportive, kind, positive friendships. Now is the time for us to focus, I think, on kind talk, reflective talk, rather than change talk. Change is going to come. This is some advice from, I'm afraid I don't know how to pronounce this person's name. I'm never sure when you just read it, but I'd say Leibenguth, not sure. Scandinavian, again, comes from the world of business. This is advice on how we can promote kinder workplaces. I don't know if it necessarily works in social work or if it necessarily works with remote and blended ways of working, but it's just some things to throw into the pot. Slow down when you come into the office, say good morning or hello more often, smile when you do. Smile at a colleague every day for a week and notice what happens and how you feel. I do think we can smile more. Be considerate, making yourself a brew, ask other people whether they want one to. Be more vocal in your praise. Engage your ears. When you're asking colleagues, how are you, stop and really listen. Be interested in how they really are. Help a colleague in need when you're able to. They also advise make time to write a personal thank you note or email or gesture to a colleague to show them that they're appreciated. I know one team where they've really started to try to build on this idea of kindness, and they have a kind bomb. It's like a big mug and it just says you're great, and they fill it up with, I don't know, a bit of a nice fancy tea bag or a bit of hot chocolate powder or a chocolate bar or something, and they put it on somebody's desk each week, a different person's desk, and they say, here, you've been bombed by a colleague with kindness. The kind bomb. I don't know if the word's the right word. I don't think I use the word bomb, but that's what they've been using. Make time for your colleagues. If you can, talk about things other than your work, even if it's just once a week. Show appreciation. I think that's very alien to English culture. Somebody says, oh, you look nice. It's all just off the market or something. We can't take compliments. We need to compliment more and we need to accept it. Someone I did a session with earlier this week said, you know, I really don't like the mushy stuff. I really avoid the mushy stuff. Some people love the mushy stuff. You know, we've got to find ways of doing this. And I think somebody said in the chat earlier, we've got to be person-centered in this because different people like different things, don't they? And what is a kind act to one person would be unkind to another person. And maybe that's why we avoid it, because it's so different. Wish somebody well. All of these things are things we could do. And I'm trying to build up to asking you, what are you going to do? What can you do? I think the idea of critical friendships is more important now than it's ever been. I wonder whether now that we're working in a more blended way, people are working from home a lot more, maybe we are recognising the critical friendships that we developed with our colleagues at work. I love the idea of Batman and Robin that we had earlier, because that is so clearly a critical friendship between Batman and Robin. I love the idea of we both wanted to be Batman as well. I think that's also great. But critical friendships really matter. And a lot of new workers are feeling much more isolated than they have been. And a newly qualified worker just a couple of weeks ago said to me, I feel like I've become my own critical enemy, sitting on my own at home. I was so sad. We need critical friendships. And then change talk, you know, sustain talk. You hear it such a lot, don't you? They're referred to in motivational interviewing. Peer mentoring also talk about change talk and sustain talk. Even the images that you see associated with it, you know, that image that I've put on the screen there, sustain talk, change talk, they're all about conflict. There has been a movement in some areas in business, which is actually quite dated, actually, in the business world. When I talk to my husband about business, he says it's really dated, but it's starting to be brought into social work around the business of social work and seeing as conflict being helpful because it creates change. And that really worries me, because that whole idea of bringing conflict into the workplace, all of that, I'd like to see us make more reference to kind talk, reflective talk. Change talk is, yeah, for me, it's harsh stuff at the moment, and the language around it. Think about appreciative inquiry. I'm hearing that a lot in social work at the moment, you know, appreciative inquiry, but I've seen that done with little of the appreciative. A lot of the what didn't go well, what do you need to do differently? Whereas actually appreciative inquiry is appreciating what is. Appreciating it, starting off from appreciation. And I think when you're working with, even with a student who is struggling, marginal, we can start from a position of appreciation. And I saw on Twitter, so I don't want to spend lots of time on this, but I saw on Twitter that Audrey gave you an idea for gathering feedback in a kinder way, perhaps. And I think that's important. When I've looked back at feedback, this is something I've used for ages about feedback, because I've been trying to find where have I used the word kind in my own work, and I used this to spell out feedback. Feedback should be facilitative, evidence-based, given early in a placement. It should be developmental, helping the student to develop and grow. It needs to be kept balanced, it needs to be accurate, clear, and kind. So I've thought about kindness in feedback for quite a while, but sometimes have struggled with how do we do that. When I did my own practice educator training years ago, and it is a funny story, but it's completely true, I got completely focused on the feedback sandwich. I bet you've all been trained on the use of the feedback sandwich, and I was like really, you know, I was quite new to practice education and to supervision of any kind, and I remember having loads of input about the positive sandwich. I was really focused on I've got to do the sandwich, I've got to do the sandwich. And I did an observation with a student, and it's probably the worst observation I've ever done, actually. It was really early in my practice education career, but it went terribly badly wrong. From the minute we knocked on the door, really, and the person opened the door, it was all going badly wrong. And then part way through, I'm sitting there doing nothing, just observing, as you know, I'd been trained to do. And then the person, one of the people involved in the visit, went into the kitchen and started rattling the knife drawer and said, I'm going to kill that social worker. Didn't use quite that language, but I thought we need to get out of here. So we left quickly and took a bit of persuading. I got the student out, and then I remember driving away and thinking, I've got to give them some feedback now, and I've got to keep it positive. I've got to do the sandwich. I've got to do the sandwich. And the only positive that I could find was I liked the way you walked down the path and knocked on the door. And it just still to this day, I think about myself giving that feedback, and I think I got so focused on it. I mean, goodness me, if that's the only positive you can find, you know, it's gone badly. I don't think it always is kind, though, because I think people have got so used to it. One of the problems with the positive sandwich is you say something positive to somebody, they sit and wait for the negative. So I don't think it is always kind. I like the idea of feed forward. Some people will say it's a bit of a play on words, but Marshall Goldsmith talks about feed forward and changing, not looking at feedback, but feeds forwards. So the idea about really, it's just about focusing on the future rather than on the past in many ways. So for example, rather than when I'm working with students, rather than asking them to get feedback from the people they're working with, I ask them to get feed forward. So I'll say to them, think about an area you'd like to improve. So instead of saying to the team, can you give me some feedback? Maybe say to the team, I'd really like to improve my assessment skills. Can you give me 3 ideas about how I might be able to do that? Because what that does is it gives them something that they can use to grow. I also think it's really good to use a similar technique, something when you're getting feedback from service users about the person. But I know that Audrey gave you some really good techniques earlier about a wand and stuff, so I'll move on from that. I mentioned kindness was in SHARE. If you're not familiar with SHARE, SHARE is a component model about practice learning that's spelt out through seeing, hearing, action, reading and evaluation. You can use SHARE to think about the student's experience. So the top line of this grid is the student's share. That's their learning. What does the student see on placement? What will the student hear on placement? What will the student get the opportunity to do on placement? What will they read? How will they evaluate their experience? Underneath in italics on here, I've put the way things have changed with the pandemic. Students aren't getting as much opportunity to observe in a traditional way. So you might need to rethink it, but using SHARE, that can help you to break it down. Thinking about the bottom line is the practice educator's share. In a way, that's the assessment. So this helps, the SHARE gives us the balance between what we do in order to help people learn and to assess them. So the bottom line is your share. What do you see of the student's practice? What do you hear about the student from the student and so on? What do you need to do? Reading their work and evaluating their practice. So SHARE can help you to think through a student's experience and the shared learning. It can help you to evaluate stuff. It's really good when you're looking at your PEPs and writing an assignment about PEPs and so on, and SHARE can work really effectively. But I suppose what I'd say is you could share the kindness. What does the student see? And how is that demonstrating kindness? What do they hear? What are they doing? How do they show kindness and how do they get kindness? SHARE is from different perspectives. So you could use SHARE to think about that. The key thing is keep kindness on your professional agenda. Just, you know, keep it there. It's not on the theory agenda. We think it is and it isn't, and we need to put it on there. So I'm going to start to draw a conclusion to allow some time for us to have a discussion, I suppose, about the things that I've shared with you in my thoughts about the theory of kindness or the actions of kindness as a practice educator. What I think is really important is recognising that a single act of kindness can create a ripple through that workplace. So if we are in an unkind workplace, every bit of kindness, none of it is wasted. I think I forgot to reinforce for you earlier when you went to get your objects of kindness that I wanted you to bring back a penny piece. Throwing the penny into a wishing well is a wish for kindness, but it brings out a ripple. My wish is for kindness. Caroline Aldridge. One thing Caroline says, this is why you see the word kindness throughout her book, He Died Waiting. If I could change one thing, it would be an increase in kindness, she says. If we were all kinder to each other and tried to understand that with a few exceptions, people want to do the right thing. We're all capable of making wrong choices and being good people who do bad things, all of us. Whether we're a senior executive, a frontline practitioner, a family member, or someone who uses services, we will mostly be doing our best. Yet we'll sometimes make poor judgments or act in ways that we feel ashamed of. Then, human nature being what it is, we'll find ways of justifying or minimising our errors. And if that doesn't work, we'll blame someone else. I asked you to get a penny. Philosopher John C. Morgan says kindness has got two faces. Now, where I grew up in Manchester, that'd be a phrase of, oh, she's dead two-faced. That'd be like really unkind. So when I read that, I was like, what? Kindness is two-faced? But then John C. Morgan says, The inner face is kindness to yourself. The outer face is kindness to others. And that made me think about the penny. And I wanted you all to bring a penny. If you've got a penny, keep that penny, take a look at it, think about what the penny might represent. Could represent a whole range of things. It's going to represent the fact that I'd like a penny for your thoughts at the end. I'd like us to have a conversation about it. It could represent a shiny new penny. People talk about things being 10 a penny. Kindness isn't 10 a penny. It's there. It's a great, great value. It has huge value. But it costs little. Change, small change. You've got that one penny, you've got hold of it, and it's change. And I'm going to ask you what change you're going to make. There's two sides to this. Just like there's two sides to the coin, there's two sides to this slide. One of them's blank because it's for you to decide what change you're going to make as a result of the conference today and pulling everything together in the conference, maybe specifically as a result of kindness. And I'll tell you that as a practice educator, doing all of this work on kindness, one of the things that I'm doing, change that I've made, is I am commenting on students' kindness in the reports that I write about them. So where a student has shown kindness, I make a comment on it in the final report because I'm valuing it. I would never have done that before because the standards, it's not there in the standards. Writing the report to meet the standards, I'm not going to write about the student's kindness. But now I am. I make sure every student I work with, if they show kindness, it's in the report. I'm just asking you for a penny piece of change, not a lot of change, a penny. You can't buy anything with 1p. But in looking at the figures, 2021, there were approximately 105,000 people employed as social workers in the UK. There's 4,650 students enrolled on social work courses in England. I couldn't get figures for across the whole of the UK. If we added all of that up and if they each made a single 1 pence worth of change, you can't get very much with a single penny. I don't think you can get anything now. I don't think they even do penny sweets anymore. But it'll really add up. Change adds up. And I think it's important to think about, when I was talking to Caroline Aldridge, I said to her, what's the opposite of an emotionally barren organisation? Is it emotionally rich? And she said, well, I suppose the exact opposite of barren would be fertile. So maybe it's an emotionally fertile organisation. And I think we can create both. And this image is supposed to demonstrate emotional richness and emotional fertility. We can do that, but it takes courage. Lots of the pictures that I've used in the presentation this afternoon, I wanted the presentation to be visually stimulating because I wanted you to sit and just go with it and see some beautiful pictures. And I've used lots of pictures from the natural world. Because, you know, it's a jungle out there, as they say, but actually, you know that phrase, it's been used a lot, quite terrifyingly during the pandemic, of survival of the fittest. I prefer the phrase used by Dasha Keltner, survival of the kindest. And so I'm going to stop the screen sharing there. You'll get all of those slides. I've not had anything to present to you as, here's a finished article. Haven't done that. I've not come and said, look, you know, here is what I think and what we should be doing, and here is the theory of kindness. But I've tried to bring to you some of what I've been struggling with the last 18 months or so, thinking about kindness. It would be very kind if people would put their cameras on now, and some people would have their cameras so that we can see one another and talk and have a conversation. To have a penny for your thoughts would be lovely. What you've been thinking as I've been talking you through things, is there anything that you've had when the penny drops? You know, sometimes there's that penny dropping moment, which is fabulous when you work with students and you see the penny drop, and it's great. It's like, just that's the moment that we want to work for. So just putting it all together, I started off with the what, why and how, and for me, kindness is our why in social work. And I think I saw something in the chat earlier on that said you were told working in duty isn't about relationships, it's just get in, get out, get it done. And I think why we come into social work is not get in, get out, get it done. It's about relationships, it's about kindness, it's about making a difference in people's lives. So we come into it with kindness, for kindness, whatever. Kindness is one of our whys. It's the so would anybody like to share anything? I mean, we've got 20 minutes or so, haven't we? I always like to finish 5 minutes before time to give, because people are generally clicking into something else, so we've got a bit more time. I can see some people have got to dash off, and I get that, and that's okay. But and I'm going to ask if we can stop the recording perhaps now for people who are doing the recording, because sometimes it puts people off talking if you think you're going to be recorded. So the presentation part of the session that people might have missed has been recorded, but if we can stop the recording or pause the recording, it would be fabulous if people have something you would like to share. And I'm going to hand over to you and just say, there's my thoughts. I think you've put some great stuff in the chat, very thought-provoking things in the chat. Beck, you've put your hand up. It's always lovely to see you, Beck. What have you got?
Thanks, Siobhan, for joining us today. And I just wanted to acknowledge that you'd shared the share model and the way that you did it, and linking it to the role of the student and the practice educator, and looking at it from their two perspectives. I think that's really helpful. So thank you for presenting it in that way and giving us another way to use it. That's been really thought-provoking.
That's interesting, that, Beck, because that was actually the way it was designed to be used, and then over the years it's been used in lots of different ways. So a lot of people didn't know that was the original. The original was for practice educators. So and it was about the two different, you know, perspectives. So that's interesting. Thank you. Thanks for that. Claire, you've put your hand up as well. People are being very polite, aren't they? Putting their hand up in the electronic chat. I never know how to do that. Claire, you put your hand up.
I can only say thanks ever so much for bringing to this forum the thoughts about kindness. I mean, I entered social work a long time ago, and I was always brought up to treat people how you would wish to be treated. And I've carried that through in my professional work and as a practice educator. And I hope I've instilled that into the students I've had. But some of the information, it's been really thought-provoking, and I do thank you for it, because I've often said information needs to be cascaded from the top right through, and sometimes it's those at the top of organisations that don't actually appreciate the hard work of us practice educators, that, you know, they make decisions on policy and procedure, and quite often